Hello, my name is Melissa Souza, and today I am going to be discussing epilepsy and how it affects people both in history and today. Before I dive into the different types of epilepsy, I want to talk about what epilepsy is. It is known to be the most common neurological condition that affects people of all ages. Now, what is a seizure? A seizure is an uncontrollable movement in the body caused by electrical activity in the brain, and it can either occur inside one specific part of the brain or throughout the brain in its entirety. It is known that seizures tend to last as little as 30 seconds, but it can last all the way up to 2 minutes. However, if the seizure has lasted for up to or longer than 5 minutes, it is tended to be considered a medical emergency and to call 911 right away. There are two different categories for seizures as they affect different parts of the brain. These are called either partial seizures or generalized seizures. Partial seizures are known to be located in only one part of the brain and can be divided into two further different parts, with simple partial seizures staying in one place and complex partial starting in one place and then continuing to move throughout the brain. Generalized seizures, on the other hand, they do show similar symptoms to complex partial seizures, but the main difference is that generalized seizures tend to occur throughout the whole brain during the entire seizure instead of just moving around. As for what types of seizures people can have, there are lots to list. Many of these can include forgetting where you are and/or passing out, having trouble moving parts of your body, no control over the spasms in your whole body throughout all of your muscles, mood changes such as increased anxiety or loss of emotion by just staring into space, and lastly, having trouble speaking. Lots of incidents, including deaths, could occur, not from the seizures themselves, but from the outcome of not being in control. And what this can lead to is falling, drowning, and many other horrible possibilities. One of the first recordings of epilepsy was from ancient Mesopotamia all the way back in 4000 BC. 1,000 years later, around 3000 BC, the Babylonians had discussed symptoms that these people were experiencing. They created words in the picture on the right here, which are not entirely translatable, but some of the words describe how the people fell over, had fits, and experienced undesirable tantrums that were undescribable for people to understand. Now, the first person I want to talk about that was a psychologist that had studied epilepsy was Dr. John Hughes. While there were many people throughout history that he had studied that were known to have had seizures, these are the three that I had picked. James Madison, which is in the top left corner over here, King Louis XIII of France, who, in case you don't know, he was a monarch that was alive between 1601 and 1643, and Charles Dickens, who was a famous English author in the 1800s. It was found out that all of these figures were misdiagnosed with epilepsy, but after John Hughes had done some research, he instead found that they had suffered from either two different types of seizures. They either had psychogenic seizures, which were caused by abnormal brain function, or they had seizures caused by drinking 3 or more drinks, and known as alcohol seizures. And after they had withdrawn from the alcohol between 6 and 72 hours, it had shown that because of the withdrawal, their bodies would be deprived of the alcohol and instead go into shock by having a seizure. This also shows how alcoholism was also a major key factor in epilepsy. From these seizures occurring, it could also be a major factor in how a lot of these people in history could have become alcoholics. And this is why these two instances were possibly linked together. While John Hughes doesn't state which type of seizures each of these individuals had. It was also known that almost more than half of these people had severe health problems throughout most of their life, especially after they were born, which was likely adding to their seizures caused much later in their lifetime. The next psychologist was actually a group of people. They performed many types of studies, creating randomized controlled traits with 4 different types of interventions. These types of interventions are psychological, self and family management, adherence and educational, and many other factors, but these are the 5 main ones. These had the psychiatrist ask them questions, ask the family how they cared for that member of their family, and finding out more about the person. Excuse me, earlier I meant to say psychologists, not psychiatrics. That was my mistake. The psychologists found out that when people experience a calm family life, have access to medical professionals, and a balanced medication, seizures caused by stress mainly were able to become less likely in comparison to people having seizures with unbalanced lives, which showed much higher percentages. How can somebody get epilepsy? Well, it is actually known that men are at a much higher increase of getting epilepsy than women. And at the same time, people that are minorities and people from poorer financial backgrounds are also at a much higher risk of developing epilepsy because of not being able to have access to healthcare, medications, etc. Now, ways that somebody could possibly get epilepsy, genetics do play a factor, but it's not 100% conclusive of somebody's offspring ending up with epilepsy. It's also possible of people getting it from head injuries, such as strokes, brain tumors, traumatic brain injuries, and even alcohol and drug abuse. This here is my peer revision study that I had found on epilepsy itself. It had discussed the links between COVID-19, epilepsy, and how it affected the epileptic population and their families. Here they discover that after the shutdown during the pandemic, many people weren't able to get in-person contact with their neurologists and had trouble getting their medications while having an increased amount of seizures more often due to the stress, anxiety, and confinement to their homes, as well as the loss of contact with others, and even getting paid less due to the effect the seizures were having on their everyday lives. Seizures were also occurring in patients with no history of epilepsy. Stress was seen as one of the main culprits for why this was occurring, due to the history that epileptics had similar relations with stress, especially with now a weakened immune system. Many neurological complications have been known to occur, especially with contracting a fever and having delayed brain activity occurring either at the same time or extremely close to one another. Possible treatments. There are lots of ways that people can get treated for their epilepsy. It's important to have a medical professional for the patient in order to discuss their symptoms, age, gender, and mainly if they're female, potential pregnancies and other factors. Professionals can properly describe certain medications for whatever symptoms and stage of life each person is at, as well as for females, like I stated in particular, as certain medication can cause harm to unborn babies. The most common types of medications, that the people can take from are called AEDs. And if people don't work to help with either results of better control or even the ability to get rid of them completely, there's surgery, removing a small part of the brain that's found to be the main cause of the seizures, or planting a device inside someone's body to help with controlling the seizures. So those were other methods that somebody could do in place in case the medications ended up not working. Now, the surgery can only be done if the person mainly has partial seizures, which means it occurs in a small portion of the brain. It doesn't spread throughout it entirely. So that means that they were to have general seizures, that they would not be able to have the surgery because it affects too much of their brain. And what people can do instead to help that is instead placing the small electric device inside their brain to help control the seizures, and even be put on the ketogenic diet, which has been found to have some effect in helping with dealing with epileptic seizures. Now, as for looking into different educational programs to